host Khushri Awasthi, and you are watching our show, The Story Makers. Today, we are having a very special and renowned guest, the specialist in homeopathy, who has been honored by the World Homeopathy Medical Institute, graduated from the Bombay Homeopathy Medical College, has rejected the big offers from London and chose to stay in their homeland and serve to the nation. And also, in today's state, they are having more than 150 countries patients as a consulting power. There are many things about them to say, but it will take a day. So let's ask them what they have done and how the journey has been. First, we'll start with you, sir.
I'm Dr. Mahendra Kabra
Ji.
and belong to a family of doctors. As you said, I graduated in 1985 from Mumbai, and I was continuing dad's practice, which was a modern medicine practice. But family encouraged me, and I was also disgusted. Dad being such a successful practitioner, used to be hundreds of patients in a day in his OPD. But still he said that we are not happy, we are not content with the results. Means it's not sustainable, modern medicine results. So homeopathy is good and you should focus more and more because it is curative. And then after 6 years, I stopped modern medicine practice, and my elder brother suggested to focus on some topics, burning issues. And this is how we started focusing more on skin and allergies, and attended so many thousand patients in last 40 years. And I am the first in the country to get the World Homeopathic Congress Research Award. And there was a news in English newspaper in the country that our country gets recognition due to this award and research work. Our country's account was open in the World Congress. And my mother taught us that don't count the money, count the successful patients. How many patients you cured in a day?
Definitely.
And then I used to get a bit anxious, annoyed in those days at that age. And she used to preach us further that if you follow this, then you don't have to count the money. And this is how we always focus on the success rate. Our principal has taught us that cure should not be by chance.
Yes.
Failure should be by chance. So this is how we started and tried to giving solace to the suffering souls.
Dr. Yashvardhan, help our audience to know more about you, please.
Myself, Dr. Yashvardhan Kabra. I have done my MBBS and MD from KM Hospital, Mumbai, and post MD, I have done my Masters in Faculty of Homeopathy from UK, United Kingdom, and I am practicing as a homeopath and integrative physician since last 13 years. And through online and offline different services, we are reaching to patients, we are treating them worldwide and treating the challenging skin diseases and allergy through homeopathy and naturopathy. Yes.
I guess the whole family belongs to the commendable jobs, like the way you are expressing yourself into the different kind of fields, but specifically medical. And my question is, it is surrounded by the topic that we have to discuss today, the skin and the allergies.
Right.
Talking about the skin allergies, there are n number of skin allergies that are even untitled and nobody talks about. As we know that you have conquered many more things in this field, I want to know how are you dealing with such things?
Although you have asked about skin allergy, but I would say that all skin problems are not at all skin ones.
Okay.
They are secondary to the primary cause inside. And in simple terms, there is a accumulation of toxins due to some reason in the system, in the blood and body. And these toxins are at the quantum beyond body's threshold to digest, detox, handle inside. And then brain decides to expel those toxins out. and that is how skin disease or skin allergy takes place. So very interesting, you may find that itching is the reflex which can save life. Brain orders your nails to break the skin and make the way out for the internal toxins. The way emergency valve of a pressure cooker, when steam reaches beyond particular dangerous level, then emergency valve opens. In the same way, toxins come out, and depending on the type of toxin and depending on the weak cell theory, target cell theory, particular type of skin disease or allergy takes place.
So if we don't treat it at a very mild stage, one day it will just
Obviously, what happens instead of treating these internal toxins and internal detox means filters, someone has constipation, other has asthma, so these are the reasons filters are not functioning properly. So with this kind of approach, the internal filters and detox takes place, and if that is not done and just itching is stopped, or just external treatment is focused only on the skin, then separation of these toxins. I'll utilize the same example, that if emergency valve does not open, what will happen?
It will get all inside and
Blast.
Yeah.
The cooker will blast. So suppressing or stopping the elimination of these toxins can lead to.
I guess the allopathy does the same thing. It just suppresses the problem.
So this holistic approach, that curing within, is more important.
So Yashvardhan, my question to you is that it is generally assumed that these type of skin problems are generally inherited from the ancestors, or it is just generational problem. Is it true, or it comes from within?
Yes. In some cases, in we can say minority of cases, it is heredity. But as we discussed before, that skin condition is basically not a skin condition. It is an outer manifestation of an inner problem. That means the toxicities which are accumulating inside, it leads to imbalance in the body. Hence, according to susceptibility or proneness of the person or family history, the person develops the skin diseases. So if there is a suppression of itching for long term, that means we have suppressed a superficial symptom. So the accumulated toxicity, that is the free radicals, that damages the more internal organs, or they damages vital organs. They cause the more imbalance in the skin, and slowly that itching get converted into the dermatitis, and the dermatitis again suppressed, it leads to psoriasis. So initially, first symptom we should not suppress, we should clear it, or we should treat it more with holistic approach, so that the root cause should be eliminated. Otherwise the symptoms goes worse and disease get more deeper.
So, like as we said before, that there are n number of skin problems. But nowadays, the most common problem that we tackle is the, I would say, I'm not remembering the name, vitiligo, I guess. So, what kind of vitiligo problem is? Because as I see people, there are patches on their skin, the white patches on the skin. What actually causes?
It is nothing but the toxin theory only. But here the difference is, melanocytes are the target organs, and melanocytes are the cells responsible for production of melanin pigment. And pigment gives color to the skin and protects from UV rays of sunlight. So when melanocytes are weak and toxins are of particular type, or there is a family history, or as you were asking, and whole comprehensive or multifactorial phenomena it is altogether.
My question to you is that when I was a kid, I used to assume that if I touch that person, it will get into my contact as well. So is it like this, or is it just a myth?
Yeah, it is definitely a myth. Vitiligo is non-communicable disease. It is, the reason is not infection or any other thing. It is just a internal imbalance, which is leading to.
It is not even non-contagious.
It is non-contagious.
There are no microorganisms. It does not spread by touch. sorry to
Yes.
add,
So
but there is a big myth in the society, so it needs to be endorsed by both, that it does not spread by touch, it is non-contagious.
I guess sometimes the reason behind this problem is the difference of combination of food we have. Like you can't have spices and then have milk. If you will,
Yeah, means animal food and milk
yes.
not together, or citrus fruit and milk not together. These are the myths in the society. And so there's a one interesting story that uh, a patient was asking me repeatedly
Yes.
that, sir, tell me that I had milk sweet in the night in the party along with sour things
Okay.
like chats and all, citrus. And I got vitiligo in the morning. I said, I'll tell you, let me examine you. No, sir, please tell me. He was so anxious. Then I gave the example that how many persons were there in the party. He said there were few hundred. I said, does everyone got it? So where there is a root cause, primary cause, along with secondary cause. So internal imbalance, there are three fundamental disorders as per homeopathic concept. So these three fundamental disorders are responsible for all sorts of all sorts of chronic diseases.
What are these?
Okay. These are the medical terms in homeopathy. One is sora,
Soda,
second is syphilis,
syphilis,
and third is psychosis.
psychosis.
Yeah. So these three disorders plus these external factors, as Dr. Yashvardhan was saying about environmental pollution, and you were asking about contradictory diet. So unless there is a internal disorder, primary disorder, others don't get affected. Why few percent of the population only? This is the whole answer.
My question to you is that is this disease or is this skin problem curable or is it chronic?
yeah, basically majority of skin problems are chronic. It comes under the
Yes.
chronic diseases, and when we are treating the root cause, yes, it is treatable, and there is very less chance, rare chance of recurrence also, specifically in vitiligo, because as we were discussing before, it is multifactorial. Many times we see someone is getting injury, like childhood injury, and vitiligo started after that, the injury never healed, or after burning the skin they started with vitiligo. Someone is using the bindi, someone is using the rubber shoes. So it is multifactorial, but many people are using the same things. Why they are not developing the same disease? Because these all are the different factors, but main reason is internal imbalance. So the more suppression and more imbalance, yes, there is a more chance that external factors will work on that, but with the proper treatment, yes, it can be treated.
My this question is for both of you. This generation is really conscious about how they look and how people are going to see them. Am I looking fat or is there anything on my face that doesn't suit me? But if you are suffering from this problem and there is nothing you can hide, there are so many insecurities, anxiety, depression takes place. How to cope up with it?
See, uh, beforehand, many skin diseases were incurable. That's why there is an anxiety, because we see different skin disease patients for years together, every nook and corner, and that's why more anxiety. And you were speaking about disfigurement. You'll be happy to know that this holistic approach not only takes care of skin, not only particular skin disorder for which patients approach us, but skin tone becomes very light. Is so happy that says that our skin is so not only skin but skin tone goes.
Even with the when detox process is happening, from inside, the root cause is eliminating, that time we see there are multiple side benefits also in patients. Like when we are treating for vitiligo and patient is having chronic gastric trouble, constipation, maybe allergies or thyroid, in that also they are seeing the benefits. So yes, when
They're very happy, means
with the side benefits.
People are more inclined into meditation and yoga processes for every problem. So, does yoga and meditation actually help in these kind of problems, or well, or is there any other thing?
In our view and uh, experience of these decades, sweat out is more important.
The more you sweat, the more toxins you'll release.
Because
Means we
skin
have
is a
a charity clinic also,
Okay.
and all laborers, field workers, farm workers,
farmers.
they get well very faster because all types of toxins get eliminated through the sweat.
Oh,
I would dare to say that 1 gram of sweat is more precious than 1 gram of gold or platinum.
that's so commendable thing that you have just said.
Yeah, sweat out is very essential.
And that's why people are nowadays very fitness freak. They are giving time to themselves in the fitness way. Okay. Talking about your journey, I just have said that you have received so many prestigious awards and have been honored. How did it all start? From
Oh.
where did you start?
I think, as said, that we started with continuing the dynasty, dad's practice, but we are driven by the values, and it is very difficult to see the sufferings of others.
Yes.
And it's good you asked it almost again that my room partner in hostel, medical college hostel, had vitiligo.
Okay.
And we approached our senior professor in OPD, college OPD, and he said that these are the arsenic sulf and these are the common medicines. You can try that for a few months, but it's difficult to get out of it. And then after starting the practice, these things was in mind that when homeopathy can take care of so many difficult conditions, more serious than vitiligo or any other skin trouble, then why not vitiligo? And I was waiting for the first patient to approach me.
Wow.
And in 1987, first vitiligo patient approached, and we could free him from vitiligo. And then there was nothing to look back.
Sir, is there any specific diet plan or the vitamins, supplements that we should have to get rid all of such skin problems? My question to you as well. You both can answer on that.
Yes, with the medicines, yes, we always advise, to have more plant-based diet, and we need to avoid animal-based diet more in basically a chronic diseases like all the skin conditions. So basic diet is more plant-based and less animal-based diet, and citrus fruits, vitamin C. Yes, it definitely helps to get rid of toxins. It helps in detox and healing, both the actions. So there are many contradictions on vitamin C, taking vitamin C in the skin diseases, but in our protocol since last 35 years we regularly ask patient to take vitamin C in all the skin conditions, and yes, it helps. And regarding like dad mentioned before, the fitness, the sweating out, it is the uh, main thing in the protocol, because skin is the biggest excretory organ and sweating is a byproduct of skin.
Yes.
When we are taking toxins out of taking out through the sweating, the natural detox happens, and when it is coming out through the skin disease, the pathological detox is happening. So if we are doing more natural detox, the skin conditions get controlled faster, and yes, it
And
goes
I
towards.
would add a few lines that synthetic chemicals are also, they act as a trigger uh, where there is a primary disorder within.
So when I was diagnosed with urticaria,
Mhm.
the doctors were like, you have to avoid eating such things, you have to avoid wearing such things, you have to avoid being in these kind of atmosphere, weather conditions, and there were so many things, and I was frustrated what to do now. What are the problems
I
then?
will not only urticaria, not only skin rash, but we will speak about all allergies quickly. Uh, if you are tested for allergy and you are the cause of means allergens are listed, those allergens do not affect others.
Okay.
The food which you take from the same kitchen, other family members do not get affected.
Yes.
So in this situation, and we'll speak about other allergies also, like respiratory system allergy,
Yes.
digestive system
Asthma, like you
allergy,
said.
asthma. So the change in the person's physiology
Yeah.
is the real cause, and those allergens are the secondary causes. Because when person is others are normal in the society, in the house, they don't get affected. There is something wrong in the person's, this patient's system, which we have already discussed. And when that is taken care of, means detox is done, then you do not get influenced by the same allergens. Although allergy testing says that yes, you are allergic, after our treatment allergy test becomes normal.
So one advice Dr. Yashvardhan just gave, that we should avoid animal-based food and start eating plant-based food. Why is it so?
In fact, we should eat what monkey eats.
Okay.
Yeah.
Why?
Because our system is created for plant-based diet. We are herbivores basically, and the real cause of all problems is, as we discussed, animal food, cooked food, synthetic chemicals, lack of sunlight, and laziness.
So, but talking about before the time when there was early man era, they used to eat animals, the raw animals. Why is
After
this?
after the evolution, as per Darwin's theory, yes, we were omnivorous, and gradually we became herbivores
Okay.
because we are evolved from the
That era.
basic lives.
Sir, how did this vitiligo discovered in history time, and how it was treated before?
Very good question. Ancient times and mythology,
Mhm.
the father of Pandavas, five Pandavas,
Pandu.
King Pandu.
Yes.
The Pandu name derives from whiteness.
Okay.
And as per means it was due to anemia or due to vitiligo, not sure, but yes, it dates back to that incidence.
Okay.
And another celebrity is pop star Michael.
So everyone has a different skin tone. So if this vitiligo happens to a person, how what kind of patches will it happen? Like,
Yes, its answer is very short. Milky white patch is vitiligo.
okay.
Milky white. Even patient can diagnose it. But this leads me to add that there are many types of discolorations, faint discoloration. Forget black and dark discoloration. But they are due to fungus, due to vitamin deficiency, due to allergies. But we, as we are discussing again and again that internal cause is more important. There is one interesting observation out of so many patients that we came across many cases where even biopsy could not establish the diagnosis. There are more than 2,400 diseases, skin diseases or disorders, as per CDC USA website. And certain patients were not fitting into those labels. And they were very anxious. 40 years, last 40 years, they are suffering from skin trouble and no diagnosis is established. So, this detox theory and taking care of internal three causes, just oral medicine, there is nothing to apply on skin. These are the very important advantages of our treatment. Although it is a skin disease, there is nothing to apply, nothing not to expose to sunlight or not to expose to UV rays. So even undiagnosed skin conditions also get sustainably cured.
My question to you is that you were offered a very big opportunity in London, but you chose not to go for it and stay in your homeland and serve to the nation. What motivated you at that time?
We belong to the family of freedom fighters, and means whole globe is a nation, one nation, and irrespective of the patriotism, we are committed to heal the whole world. Where we stay is not important nowadays in the era of internet and smartphones. And uh, just a examination over a video call and medicines couriered, and we can help the patient anywhere in the world.
Dr. Yashvardhan, it doesn't matter who your father is, it doesn't matter who your grandfather is. The kid has lots of dream. I want to become an actor, a cricketer. What was your dream? You always wanted to become a doctor. You always wanted to go on the path that your father is leading, or was it before it was anything else, and then you came into this field?
Uh, no, since childhood, definitely my dream was to become a doctor, and I passionately followed, and my all parents, like elderly, guided me through that. But after doing my MBBS and MD, and to go for a higher studies in homeopathy, because we have seen since childhood a lot of suffering souls, you know, which are not treated with they have not come out to that chronic diseases, and they have treated successfully with homeopathy and this protocol. So it was always my dream to treat such challenging diseases through holistic approach. So I have chosen an integrative approach that with proper education in modern science, I have turned into the homeopathic education, and I am continuing that path to treat suffering souls from these challenging diseases.
So your father has always been your motivation.
Yes, always.
So before we wrap up, I want you to help our audience. As like you said, there are n number of diseases, the skin diseases that are not untitled and are not resolved yet. But as you are a specialist and has conquered in your field, please help our audience to know more about these diseases and how can they be cured.
So many skin diseases listed, diagnosed and undiagnosed.
Okay.
All can be, all are amenable to this mode of treatment,
Okay.
this concept, because we understand the disease in this way, in holistic way. So almost all are amenable, and success rate is very good. But we honestly refuse the patients when they have crossed the stage of irreversibility. Means they have gone into that phase of
That is, it will
irreversibility.
be always permanent.
Always means to our knowledge and to our experience, and we do it on very first day. We decline them. Patients force us. They know about us, and they are very eager. But we know as a doctor. So all skin diseases, all allergies, skin allergies, nasal respiratory allergies, all are sustainably attended with high success rate.
So you are having patients and consultants all over the world. I would repeat it again. He's having patients and consultants from above 150 countries. How are you able to contact with them and help them to get out of all the problems they are facing?
In fact, through email and mobile WhatsApp is more than enough. And this is how we are into research as we are discussing. And he's academically qualified for the research, and he has published research papers in world congresses about skin diseases, about lifestyle diseases. And so we wish to make it more and more scientific.
I believe that it was a great time having you here with us. And personally, I would say I got to know many more things about all these things which I was not aware of before, and hope that our audience got to know many more things about this thing also. And we really are thankful for having you us on this platform. For more insightful conversations like this, don't forget to follow. Thank you.